Tuberculosis perhaps appears to be an old disease affecting approximately 2 billion people worldwide. In fact, according to the World Health Organization, 10.4 million individuals got tuberculosis and 1.7 million died from this infectious disease in 2016. On the occasion of World Tuberculosis Day, WHO calls for an urgent, sustained and adequate investment in ending tuberculosis to save lives. First and foremost, unlike dry cough in COVID, tuberculosis is associated with sputum production, which is mix of saliva and mucus from throat or lungs. So, what is tuberculosis and how does it affect you? When an infected individual coughs, sneezes or laughs, the causative bacteria Mycobacterium tuberculosis travels through the air from one person to another, causing tuberculosis or TB. TB infection is difficult. It most usually affects the lungs but can also affect lymph or lymph glands, belly, spine, joints and other organs of the body. We have to remember that not all people infected or exposed by this bacterium could get sick. Some of them would be asymptomatic. People with latent tuberculosis do not produce or get sick or show any symptoms. However, if the person's immunity is compromised for some reason, the infection might flare up as active tuberculosis. Types of tuberculosis. The most prevalent kind of tuberculosis is pulmonary tuberculosis, affecting the lungs, whereas extrapulmonary tuberculosis occurs when tuberculosis affects regions of the body other than the lungs and is more common in people with compromised immunity, making them hard to keep the illness contained in a single place. So, what are the common symptoms of tuberculosis? The symptoms of tuberculosis vary depending on where the infection or germs are developing in your body. The symptoms of tuberculosis in the lungs include: number 1, a bad cough that lasts more than 3 weeks or longer, pain in chest, coughing of blood or sputum, along with you might feel weak or fatigue, weight loss, no appetite, chills, fevers, etc. Now, the symptoms of tuberculosis other than the lungs or extrapulmonary tuberculosis, which include lymph node tuberculosis, where lymph nodes situated near the neck or above the collarbone are the most common affected. This is called a cold abscess. Sometimes the node may burst and may form a fistula. Next, pleural tuberculosis. In many patients with pulmonary tuberculosis, the pleura may got inflamed because of the immunoreaction. Next, tuberculous meningitis. The brain and the spinal cord have 3 layers of tissue covering it. This is called meninges. Due to tuberculosis, inflammation of this meninges is called tubercular meningitis. Next, tuberculosis of bone and joints. Tuberculosis bacteria can cause infection to bones and joints anywhere in the body. Infection of joints may cause swelling and pain of joints, excessive accumulation of fluid with redness. Next, abdominal tuberculosis. Tuberculosis of the abdomen can result from direct seeding of the abdominal cavity or by blood spreading from the lungs. TB bacteria can cause infection of any part of the abdomen and also in pelvis, including the intestine, liver, kidney, spleen or any other vital organs. Last but not the least, miliary tuberculosis. Miliary tuberculosis is a potential life-threatening type of tuberculosis that occurs when a large number of the bacteria travel to the bloodstream and spread throughout the body. So, how to diagnose? Common diagnosis method for tuberculosis is examination and culture of sputum, tuberculin test or Mantoux test, blood test and chest x-ray. So now, treatment options. Tuberculosis can be treated when detected early. The strain of tuberculosis is also important when treating the disease. Treatment for latent tuberculosis involves early diagnosis and complete treatment. In the case of active TB, the affected ones may be recommended to take several drugs. However, the treatment becomes more complicated for patients with the drug-resistant strain of tuberculosis. So that's all for today. If you have any of the above mentioned symptoms, it's better to consult with your nearest doctor for early diagnosis and complete treatment. We have to remember that asymptomatic tuberculosis is very common. So see you in the next video. Till then, take care, be happy and stay healthy.